Summer months, scorching heat and periods of dehydration. These are ideal recipe for stone formation. Now let's see how we can prevent the stone formation and how to treat it. Hello, I am Dr. Sudharsan. I am a senior consultant urologist at Apollo Hospital Specialty Vanagaram, and let us see about the stones. What is a stone? A stone is nothing but crystals which get saturated urine and which precipitate and slowly starts becoming bigger and bigger. Now where do they form? We are not going to see about the gallbladder stones, we are going to see about the kidney stones. Now this can present either in the kidney or it can come down your passage and it can come and get blocked in one of the tubes which is called as the ureter, and it can block the urinary passage, which can give rise to pain and lot of infection. Now how do patients can identify if they are having a kind of a stone in their kidneys? Now usually it presents with severe pain if it blocks the urinary tube, just like what I mentioned just now. If it's in the kidney, it can be silent and can grow to a much larger size. And the pain is classically present in the loin, on the back side. It never presents as upper abdomen pain or something. Usually it presents with pain in the back on either of the sides, depending on which side you have stones. Or the patient can notice some blood in the urine. It can be a lot of amount of blood or it can be minimal thin streaks of blood. जैसे कुछ थोड़ा blood आता है, खून आता है. So it can present like that also. Whenever the patient has got a pain or any blood, it is imperative that you meet your doctor. You get yourself identified of the problem to look into possible treatment options. Now, what is the first screening modality? When we don't know that we have stone, we usually go for an ultrasound, which can identify if there is any stone or if there is any swelling in the kidney, which can give rise to this particular problem. Or if you are a known stone former, a recurrent stone former, then it is better to go directly for a plain CT scan, which can pick up the stone anywhere inside the kidney or the ureter or the bladder. So in this way, a doctor can decide whether you need an ultrasound or a CT to identify the stone first. Now, next comes the question that do we need to treat it? The normal urinary passage is usually about, say, it can accommodate up to 5 or 6 millimeters. So any stone which is small, say for example 4 millimeters, मेरे को ultrasound मिला, ultrasound पे 5 mm का stone मिला है. We have a stone of 5-6 millimeters. Nothing needs to be done. It can just flush out by itself. You just have to increase your water intake so the entire stone can come out by itself. We can just aid the stone expulsion with some medicines. Now usually these medicines are given to relieve the pain and also because of the stone expulsion better. Next, what are the medical management? See, there are different types of stones. Now does that change the management? No. Any stone beyond a size of say 8 millimeters or 9 millimeters, and if it is symptomatic, it needs surgery. Now, no stones can just dissolve by itself. It is just a myth that the stones can be dissolved with some medicines or with some herbal remedies. All these are just myths. What we can do is we can just change your urinary texture so that it can prevent a stone further increase in size, and whatever size stone is there, it can come out by itself by drinking lot of water. So the first important treatment for you to prevent or to treat your stone is by increasing your water intake and avoid periods of dehydration. The normal time period which we give for stone treatment medically is usually about say 10 to 14 days. You can continue with your regular work. If you don't have much of pain, then you can continue with your regular desk job, strenuous activity to be avoided, and you can take these medicines and continue with regular activity. Usual recovery time, the stone expulsion time is usually about 10 to 14 days. We can safely wait for up to as long as maybe 3 weeks, provided we don't have any urinary infection and we don't have any damage to the kidneys. Both these are imperative. If any of these are there or if there is persistent bleeding, then we need to resort to an earlier surgery. Or if pain is not settling down, again we need to go, despite the medications, pain not settling down, we can try and consider a surgery earlier. Medical treatment can be done on an OPD basis if the pain is getting relieved with medications, or if the patient gets admitted. Usually we observe for about 24 hours where we identify all the checklist complicating factors. If these are not there, then the patient can be discharged straight away and they can continue their medical management at home. So the important driving home point is that in summers, you hydrate yourself well. Even if you have some stones, small stones, it can be treated medically by increasing your water intake and by giving medications to help in expulsion of the stone by itself. And always consult a doctor and take medicines accordingly. Thank you.